Today we will discuss about an important topic called gonorrhea in women. We should all be aware that gonorrhea is a sexually transmitted disease which can affect both men and women. The importance of this disease lies in the fact that many women, almost 50%, remain asymptomatic and they may be carriers of this infection and they can actually affect their sexual partners. So the mode of transmission of this is by sexual contact. The second mode of transmission is that if a mother is infected, this disease can be transmitted to the baby during birth. Now, what we should be worried about in this disease is that if it is left untreated, it can result in certain complications. Because this disease is known to affect the genital organs, mainly the female genitalia, the infection can be transmitted upwards, that is ascending infection, and it can affect other parts of the pelvis like uterus, it can affect the fallopian tubes and other pelvic organs. So what happens if the disease spreads to the other pelvic organs? It can result in inflammation or infection, and which is otherwise termed as pelvic inflammatory disease, which can damage the uterus, it can damage the tubes. Now, once the tubes are damaged, there is a very high possibility that women are affected with infertility, which means difficulty in conceiving. Also, if they conceive, there is a risk that the embryo can grow in an abnormal place, that is tubal pregnancy or an ectopic pregnancy. So, it's very important that these complications should be kept in mind. One more thing is, if a woman is affected, there is a very high chance that because most women are asymptomatic, as I said, these infections can be transmitted to their sexual partners. Also, there is a very high risk of being affected by other sexually transmitted disease, which is HIV, which can result in acquired immunodeficiency syndrome or otherwise called as AIDS. So, who are at risk? As I said, those who have sexual partners, who are multiple sexual partners, already affected sexual partners, and those who do not seek medical help, or those who are not regularly being screened, practicing unsafe sex without using any protection.